Welcome to Good Grief Mama. I'm Allie, wife and mom of 3, and this is a podcast for honest conversations about motherhood and marriage, homeschooling and homemaking. So if you've ever felt called to do motherhood and marriage a little differently, or ever wondered, why is no one talking about this? Then you're in the right place, and I'm so glad you're here. This episode is sponsored by Restore Your Core Physical Therapy. Hey mamas, whether you're pregnant, postpartum, or your kids are in college, your body deserves some TLC. The doctors at Restore Your Core Physical Therapy get it. From pelvic floor therapy and birth prep to fixing that back pain that you've been ignoring for way too long, they've got you covered. With locations in Carmel, West Carmel, Zionsville, and Greenwood, expert care is close by. Visit restoreyourcorept.com or call 317-597-6323. Make sure you mention the Good Grief Mama podcast for $50 off a 90-minute evaluation or $25 off a 60-minute evaluation. You've been taking care of everyone else, and now it's your turn. All right, so today I'm going to take you on a journey. I'm going to tell you a little story about a time when we were on vacation in beautiful Florida and everything was going perfectly and great. And we were just about to relax until I got the flu. Yes, the flu. Let me just paint the scene for you, paint a picture for you, if you will. I've been planning a vacation to Florida, this 2-week vacation, for an entire year. I started planning it when I was pregnant. And knowing that we weren't going to go on any vacations that year because I was going to be pregnant and then postpartum, I was putting all of my eggs in this basket of going to Florida for 2 weeks. We took a 2-day drive down to beautiful Indian Shores, Florida. It was in the the beginning of January because I hate winter and I wanted to escape Indiana. Nathan, while we were on this 2-week vacation, my husband was going to be leaving for in the middle of it for a few days to go on a work trip. And so my parents were coming down for a week and they were going to be there exactly the day that he left, they were getting there. And then they were going to leave, after a week. So I had this plan. I was so excited. We're right on the beach. I had a visual schedule printed and laminated for my kids because they do better with schedules. I had adventures in plans. I had farmers markets planned, all these things planned. Wonderful, wonderful plans for this vacation. And then the day that my husband leaves and I go drive this 45-minute drive to drop him off at the airport with the kids and pick up my parents at the same airport, I wake up feeling awful, like fever. My throat is so sore that it hurts to talk. I have no energy. I am a little achy. It ain't great. So I already, though, have a plan in place and have bought the tickets to pick up my parents at this airport that I'm dropping off my husband at and to go to the aquarium that's right by the airport. Because I'm not going to drive 45 minutes to go to an aquarium on any other day. So we're just going to do it while we're up there. So that's what we did. While I was not feeling great, we went to the aquarium, but by the time we got back to the condo, I basically died. And then in the next day, my 5-month-old spiked a high fever and started waking up every 2 hours at night. And then the next day, my 2-year-old, she got a high fever and was a cough and was miserable. And she is a miserable sick person. She's very weepy. And all while I am also miserable. No energy. My throat hurts so bad. I'm coughing. It was just awful. Fever, all the things. And what happened next made me realize just how differently we approach sickness now than we used to, or than what is quote unquote normal. So let me take you on this journey on my experience with conventional medicine urgent care visit as compared to our more holistic doctor, as this relates specifically to my kids, because it was a stark difference and it's very interesting to see the differences. So here I am dying. My kids are dropping like flies and my older parents are with us in this condo and they're like, I want to know what you're sick with so that we can help not only to get you better, but also to prepare ourselves. Specifically, my mom was thinking this because she doesn't really have an immune system. So I'm pretty sure it's the flu because I had never felt this way. I honestly, like, let me just have you guess when the last time is you think I got the flu. If you guess never, you're correct because I don't ever remember getting the flu. And so I'm like, I know it's not COVID because it doesn't feel like COVID. I had COVID a few times and it's not just like a regular cold. Like I'm really down for the count. Like this is matching what other people have been saying about the flu. And so I already had started taking the oscillocillum, that is the specific term. There's a homeopathy medicine, a homeopathic medicine that starts with OSCI. And I don't know how to say it. I just say oscillocillum. But I was already taking that. It's specifically for if you have the flu. And I already was taking a supplement called Elysium, which is star anise, which is like the main ingredient in Tamiflu. So I'm already taking those things. I'm already doing all the things that I know to do when you're sick. But I'd just like someone to lay eyes on my 5-month-old because she's just so young to be having a fever like that, you know? But I'm in Florida, so I'm not near my doctor. And so I am like looking up urgent cares, you know? I'm like, I just really want someone to check out my 5-month-old. And also, I want someone to check out my 2-year-old and myself. But like my 2-year-old, I just want them to listen to her lungs because she's got a cough. I'm not so worried about her fever. But I am worried about the 5-month-old fever and just like checking her out, just making sure she's good. Give my mom my mom heart some peace of mind. So I found an urgent care and I had messaged our pediatrician in our portal, like the patient portal. But while I was waiting on them to respond, I was like, I'm just going to go get us checked out. Now, my 2-year-old and myself could go to this urgent care, but apparently the urgent care doesn't see kids under 6 months old. And I was like, we're like 2 weeks away from her turning 6 months old at this time. And I'm like, can I just like lie? But like they wouldn't see her. So I found a place that would see my 5-month-old, but wouldn't see me. So I still had to go to the urgent care for me and the 2-year-old. And then I had to take my 5-month-old to a different place. Anyway, it was a hot mess. So at this visit for my 2-year-old and myself, we're waiting in this waiting room forever and doing all this paperwork just to get them checked out. Turns out I'm the worst one, which I already knew. But while we're there, the doctor is seeing us and basically she doesn't really ask much. She just asks like what our symptoms are and swabs us. And it's not even the doctor, it's the nurse. And she swabs me. I said, my daughter, the 2-year-old, she's got whatever I've got. So you don't need to swab her. So I had her swab me for the flu and for strep. Because really, that was what I was worried about was that I had strep. And so I wanted to know if I had strep, but I really assumed I had the flu. So my swabs come back really quickly and I have the flu. I have flu B. And so then the doctor comes in and says, you've got flu B. Makes sense. You guys need Tamiflu, both you and the 2-year-old. And that's pretty much all she said. And so I just asked, I was like, I don't know much about Tamiflu. Are there any side effects to taking it? Like, are there some benefits versus risk here? Especially for my 2-year-old. Like, I don't know anything about it. And she just stared at me like for a good few minutes, like few seconds, like to make me feel like, why are you asking this? Or at least that's what I did feel. I don't know if that was her intention, but she just stared at me and then she was like, no, there's absolutely no risks to taking Tamiflu. It's like the safest medicine out there. And I was like, oh, okay. Cause I had like heard a few things about mental things, like cognitive effects, like especially in younger kids. And she's like, no, there's absolutely no risks to this medicine. And then she proceeded to tell me a story about her stubborn husband who he got the flu and he was on the couch and like dying and miserable. And she told him to take Tamiflu and he didn't. And so then he was sick for like 3 weeks, like just horrible sick and down for the count because he was too stupid to take Tamiflu. I was just like, okay. And like there was a notable and palpable shift that happened in the room when I asked about the Tamiflu and like if there was any side effects to it. Instantly, she just like got really cold and it was just a very stark shift. So she sends off Tamiflu because my mom in the room after she left was like, I would like the Tamiflu in case I get sick. She goes, I have no immune system. I'm going to go down for the count, like even worse than you guys. And so I let her send in the Tamiflu for me so that my mom could have it. It was a very interesting experience. So then we go to the place that will see my 5-month-old. And I still had not heard back from our pediatrician yet because I had sent them a message. They always get back to you within 24 hours. And we got into this urgent care in the morning. So it was like right after I sent the message. So then I go to the place for my 5-month-old where they're going to check her out. They listen to her lungs, all the things, and they swab her, even though I had just been swabbed and told them that I came back positive for flu B. They swabbed her anyway. Turns out she had flu B. Surprise, surprise. And, she's like, she comes in, she goes, honestly, your daughter looks great. Her lungs sound good. Her skin looks good. She looks good for someone who has flu B. And I'm like, wonderful. That's what I wanted to hear. And she's like, she needs to take Tamiflu. And I was like, okay. And then I said the same thing that I asked the other lady. I said, I don't know much about Tamiflu, especially in 5-month-olds. Are there any risks with taking Tamiflu? Is there anything I should know about? And she kind of had the same response. And she said, well, no, there's not. And she goes, you don't vaccinate, right? And I was like, in my mind, I'm thinking, why would she just guess that? Like we didn't fill out any paperwork basically about her medical history. So like they didn't ask anything. They just asked like her age, her her date of birth, her weight, pretty much it. That was it. Like there was very few things they asked us. So we don't vaccinate, but like I was curious as to why she just assumed. And I said, no, we don't. And she goes, well, certainly because you don't vaccinate, then your baby's at a lot higher risk for pneumonia and just like ending up in the hospital. So because of that, you definitely need to take Tamiflu. And I was just like, okay, but like, so there's no risks for a 5-month-old. Like, I just wanted to make sure because I don't know anything about Tamiflu. And no, there's no risks. And so I left both of those appointments feeling very dismissed. And I really very much had the impression that they thought I was like stupid or whatever. And they very much made me feel, especially the one with that I saw for my 5-month-old, like a fear, like, oh my gosh, maybe there is something I wasn't thinking about. Like, what if I don't give her Tamiflu and she ends up in the hospital? Or I could end up like that one doctor's stupid husband on the couch. And like they had no other suggestions for me though for any other treatments. And it's like they had no belief that our bodies were strong enough to fight this flu. And we had to take this medicine. And that might have been true for some people. But then right after this 5-month-old appointment, I walked out, like literally in the lobby. I got a call from our pediatrician we actually see a family medicine doctor, and they're more holistically minded. And it was the nurse that called, and I was like, okay, we are confirmed to have flu B. And she goes, oh, that's the worst. And I'm like, yes. And, she was asking me about how everybody's doing, and I was telling her about how we're doing. And I said, I just had my both daughters looked at, both of them sounded good, looked good for having the flu, a little bit of a fever for, the 5-month-old. The 2-year-old didn't have a fever when we went to get checked out. And I said that both the doctors that we saw here told us to take Tamiflu. And I was like, but I don't know anything about Tamiflu. Should we be doing Tamiflu? And it was like instantaneous. Oh, no. We don't recommend that at all. She was like, it only cuts your sick time by like 24 hours, maybe, if you catch it in the right window. And she goes, and it has lots of negative side effects. And I was like, these doctors here are telling me there are literally 0 side effects to this. And it's like a miracle drug, basically. You got to take it. And they're like, no, we really don't recommend it because there are negative side effects. And really the benefit is only maybe 24 hours, like of getting better 24 hours earlier. And they were like, just stay really well hydrated like you've been doing. Treat your child, not the number when it comes to fever. If they have a fever, that's fine. If they're really miserable, then maybe try and lower the fever. But like the fever is good and you guys will be better in a couple of days. And they told me what to look out for, if it progressed, but really only mentioned it. It's not like they were talking about like, because you don't vaccinate, because they obviously know that we don't vaccinate. And, they were like, just if it gets worse, call us back, or like, this is what to look for. And they're like, but really just stay hydrated and you guys will be fine. They listened to me. They answered my questions. They believed in my body, in our bodies, my kids' bodies to fight this. And I walked away from that conversation with such a weight lifted off of my chest. It's not like I felt like fear anymore. Like I did feel a lot of fear especially after that appointment with my 5-month-old. And I just felt informed. I felt empowered. I knew what I could do to help us to strengthen our bodies to fight this. And it was such a big difference. Like it was such a stark difference too, because it was side by side. You know what I mean? We had just been to this more conventional doctor at an urgent care and at this other like pediatric urgent care. And then to talk to our more holistic family medicine doctor, it was just so different. Like the side by side comparison was blinding. So the difference here was in one, the more conventional doctor, I was made to feel like I was a hindrance for asking questions, like I was stupid. Like she literally compared me to her stupid husband. She said my stupid husband didn't take Tamiflu and then was sick for 3 weeks when he could have just been over it in a couple of days, versus the more holistic family medicine who answered all my questions thoughtfully. They were like, no, you're right to question this. The difference in philosophy was different too. Like the more conventional urgent care doctors really leaned on the medicine. Like, oh no, only this medicine can fix you. Or like, you're going to die, not really die, but like your baby is going to end up in the hospital, versus like, your body will fight this. Like just provide these supports to it, like staying well hydrated and all these other supports, and you'll do just fine. It was just so different. Now, I will say the urgent care, they did get us in quickly. We saw them that same day. They gave us a quick diagnosis. They swabbed they swabbed me, and I guess they swabbed my baby too. They put actual eyes on my 5-month-old. I was very appreciative of that. They listened to our lungs. Like all those are great things, but I very much appreciated that our more holistically minded doctor called us and actually answered my questions and gave me confidence and informed me and didn't make me feel fearful about something. So really what I felt like was missing when you go to a more conventional doctor, or at least this experience. Now, I'm not saying all conventional doctors are this way. This experience though, that I had was I felt like what was missing was true informed consent. Because had I not had this more holistic doctor call us, I would have left feeling very fearful for, not really myself, because I knew I could fight it. I fought off stuff before, but like for my 5-month-old, especially for my 2-year-old, like I would have felt really fearful and I would have just given them the medicine, not knowing that there are risks to that medicine. Now, I'm not a doctor. This is not me giving you medical consent and telling you not to take Tamiflu, but like I wanted to know, like maybe my kid could have taken it and been totally fine. And I know lots of people take Tamiflu and they're totally fine. But I wanted to know the risks for it. And what I felt like that was totally missing from my urgent care conventional doctor appointments. So truly, I'm not saying urgent cares are awful. I'm not saying you shouldn't take Tamiflu. But what I am saying is that they're helpful for acute injuries, or in my instance, if you're a far distance from your regular doctor. But I want to encourage you that you should be allowed to ask more questions. And it shouldn't be a thing where the doctor instantly goes cold or like clams up because you're quote unquote questioning them. Because I wasn't even questioning her. I truly just wanted to know, are there risks to this? So I want to encourage you, if you're in this kind of experience, don't let fear take over. Don't feel stupid for asking questions or for trying to do things differently. Again, the whole point of this podcast is doing motherhood and marriage differently, because it was just such a stark difference for me. And I will say, because I started this with telling you about how much I was looking forward to this vacation in Florida, I will say I was sick for a good chunk of our vacation. And by the time that like I was better and both my daughters were better, which they both got better before me, they bounced back very quickly. And by the time that I was like truly better to like really enjoy it, we only had a couple days left of our 2-week vacation because I got sick a couple days after we got there. So it was like, it was sad. It was very, very sad. But the experience was enlightening to me because I've never had an experience where it was back to back, like side by side, to compare a conventional doctor versus a more holistic doctor. It was just two totally different experiences. So I'd be curious to know, if you've ever had two totally different medical experiences for your child or for yourself. And I want you to send me a DM or comment if you're on YouTube, especially comment on this video and tell me about your experience. You can also send us a text message where you're listening. There's a little thing you could click in Spotify and Apple Podcasts to send me a text message and let me know. You can also let me know by leaving a review or rating. But yeah, if you are trying to do this motherhood thing differently too, if you're questioning the norm, I want to make sure you're following along with me by subscribing on YouTube, Apple Podcasts, and Spotify, signing up for my free weekly email newsletter for mom hacks, marriage questions of the week, and much more. I look forward to talking to you guys more next week.